between malignant and classical phenylketonuria. So I'm going to give a quick recap about classical phenylketonuria before we can move into malignant, so that it'll be easier for you to understand the presentation of malignant itself. So I'll just go over it really quickly. So phenylalanine feeds into tyrosine, tyrosine to dopa, and dopa then feeds into melanin, and catecholamines. Now, this enzyme here is phenylalanine hydroxylase, and this enzyme is tyrosine hydroxylase. Now, these two enzymes use what we call tetrahydrobiopterin as a cofactor. And this enzyme over here is dihydrobiopterin reductase. And the same here, there's BH4 and BH2, and this is how they feed in. Now, what happens with classical phenylketonuria is that phenylalanine is deficient. Phenylalanine hydroxylase is defective, and therefore what ends up happening is that there is hyperphenylalaninemia, there is decreased melanin and decreased catecholamines. So because phenylalanine itself is neurotoxic, they will have neurologic deterioration. Because there are no catecholamines, they will have mental retardation, and because there is a deficiency of melanin, they will have oculocutaneous albinism. They will be very fair with little to no melanin in their skin and their hair. Now, so to treat this disorder, we tend to decrease the phenylalanine, and aspartame is a sweetener that contains phenylalanine intake, and they will have tyrosine supplementation. This is a part of their treatment. Now, with malignant PKU, the deficiency here is actually not the phenylalanine hydroxylase. That's not the enzyme that's deficient. It's the dihydrobiopterin reductase that is deficient, or sometimes even biopterin itself is deficient. So what ends up happening is, even with tyrosine supplementation, they are not able to make catecholamines. So we already know that dopamine inhibits prolactin synthesis. So when they have no dopamine, they will have hyperprolactinemia, and this is the key differentiating factor between malignant and classical PKU. They will have high prolactin levels, and with this disorder, we need to supplement tetrahydrobiopterin and leucovorin because